just for the audience, we've got some two terrifically experienced people from the NIHR Academy who are with us. And as a brief intro to Chris Doble and Kieran Lee. So Chris is a senior program manager. He particularly focuses on entrance to the research career pathways and also to do with infrastructure and schools of research that promote capacity development. And we have Kieran Lee, who particularly focuses on the clinical academic pathway and of note, the local authority organizations and also methodologies. So who's going to start? Chris, is it going to be you? Thank you. Welcome.
Thanks, Umesh. So yes, nice to meet you all. My name's Chris Doble, and I'll just take you through the first stage of this presentation. And we'll just be introducing sort of a wide range of the career development programs that are available. Through this talk, we'll be particularly focusing towards funding that supports those using data science tools and methods for health and care research. And we'll be very happy to share these slides after. And so I also try to add in links where helpful that may be further source of information after today's webinar as well. So who are NIHR and who are the NIHR Academy? Oh, let's jump Tom. Go back. So the NIHR Academy, we're the arm of the NIHR that attracts, trains and supports the best researchers to tackle the complex health and care challenges of the future. And we do this through a number of ways. So firstly, we develop and coordinate NIHR academic training, career development and research capacity development. One of the primary ways, which we'll mainly be talking about today, is we manage national competitions for training and career development awards. We also attract, train and support the people conducting leading research focused on the needs of patients and the public, and that's a key emphasis that will run through today's talk. And we also develop the skills of the next generation of health and care researchers to find life-saving solutions to key emerging health and care problems. So what we've tried to show here is just some data of active Academy members. So these are individuals that hold awards funded by the NIHR Academy, either through national competitions that we manage or through funding available through our NIHR infrastructure centres, such as the biomedical research centres, for example, or NIHR Schools. And the reason we've just sort of shown these plots from the data from 2023, 2024, show in the chart on the left that we do fund people across the wide range of career stages. So from predoctoral applicants, sort of master's level, to doctoral, funding PhDs, as well as postdoctoral awards across the wide breadth of postdoctoral career stages, that is, so from PhD right through to chair level. And then a fewer number, but also our prestigious sort of research professorship and global research professorship awards at chair level as well. And also the sort of wide breadth of individuals with funds. So you can see here by profession in the central chart that health and care professionals and those that are medically qualified do make up a significant portion of those that we fund, but the researchers that aren't a health or care practitioner also represent a good amount of a good proportion of the individuals that we fund through NIHR Academy Awards. I think recognising the vast contribution that these professions make to health and care research within England. And then geographically to show, as a national funder, we do fund individuals across the full breadth of England, as you can see on the plot on the right here. And so one of the key requirements, I suppose, to be able to apply for NIHR funding is that you fall within our remit. I'll emphasise a couple of key points here, but at the bottom of the page, you can also see a link to our webpage, which includes this information, but also quite a handy FAQ section that I think can be really helpful if you're looking for further information within your specific area of research. But the key things to highlight here is that our overall remit is early translational or experimental medicine, clinical and applied health research, and social care research. But key thing to emphasise within any application for NIHR Academy funding is that there's a clear potential for directly benefiting patients, service users, carers and the public. And then in the second bullet point here, we just have a few examples of what proposals can involve. One point that we like to emphasise is that for our awards that Kieran will be talking about in a second at doctoral level, early translation or experimental medicine isn't within remit for our national competitions, though that is supported through our BRCs, our biomedical research centres, with centres available locally in the Southwest region in Exeter and Bristol, example. But at postdoctoral level awards, early translation or experimental medicine is considered within remit. Though, as always with our funding, a clear and plausible path to patient, service user, carer, or patient or public benefit must be demonstrable. And one thing is that we do not support basic research or work involving animals or their tissues. And then we do also support high quality educational research and methodological research through our awards. The other point to just highlight is that today's talk will have a focus on domestic funding, but we do also support global health research and have a number of global health awards. If you're interested in that, we do have the Q&A after, but I'd also just recommend going directly to our relevant web pages on this. So we have a quick infographic here. I'm not going to spend too much time on it because we'll go into a bit more detail into each of the awards that we offer, but this is hopefully a nice way of navigating the wide breadth of things that we fund. It demonstrates the funding that we have available across career stages, but that also, while we offer a number of sort of personal, more fellowship awards, as make up most of the awards in the top half of the screen, we do also fund a number of shorter training and development awards that can be really effective at getting that sort of training experience you need to make the next step in your career. And if you're ever trying to navigate the NIHR Academy and the funding that we offer, this infographic, I think, is a really good way to do that. And one more point is that you may, when you look at the up-to-date infographic, think that some previous Academy schemes aren't on there, and that's because this year we have been simplifying our offer. So we used to have multiple different programs available at predoctoral, doctoral, and postdoctoral level, and we've been condensing them down into one fellowship award at each career stage, now called the predoctoral, doctoral, and postdoctoral awards. The aim for this is to try and simplify and make it easier to navigate NIHR Academy funding. Though we will still have a focus towards certain specialties through our committee. So, for example, a predoctoral award applicant that's a methodologist or from a methodology background would be assessed within the methodology committee, while an individual from a public health background would be assessed within the relevant local authority social care public health committee, for example. So I'll now hand over to Kieran, who's going to take you through our personal awards.
Thanks, Chris. I'll leave you in charge of the slides. Next slide, please. Thank you. Yes, so we have an undergraduate internship programme, which is designed to engage and attract students from underrepresented professions in the early stages of their academic studies to consider a career in health and social care research. So early to mid-career researchers can apply to host up to 3 interns to get hands-on experience through a fully funded flexible placement in the area or discipline they're interested in pursuing. We're looking to prioritise funding internships in the following disciplines or professions of strategic importance, which include data science and research methodology, also public health, pharmacy, etc. Successful applicants will be able to recruit interns via the host organisation's normal recruitment processes. Next slide, please, Chris. So this award, the predoctoral award, is open now and will close on the 20th of March. So the predoctoral award, as Chris mentioned, is our simplified offering for health and social care researchers at master's level. And it's available to 4 audiences. So it's available to those based in a local authority or associated setting, registered HCPs working in NHS settings, fully qualified GPs, general dental practitioners, community dentists, and HCPs working in primary care, and then also applicants who are proposing to undertake training to develop as a methodologist in one of the applicable methodological areas. Those are listed on the award webpage. So for the clinical and practitioner applicants, you can apply for 1 year's funding, full-time equivalent, although you can take up the award on a part-time basis over a longer duration. Methodologists are able to apply for up to 2 years funding, depending on the level of experience that they have at the point of application. So I've mentioned you can have the award on a part-time basis. So the lowest uptake is 30%. I think that comes out to around about 40 months. The maximum award duration is 4 years, however, so it's important to stress that if you're looking at taking it up part-time. So the award will fund either full master's fees at the UK rate or £5,000 worth of bespoke training per full-time year. So for the methodologists, for example, you could apply to undertake a relevant master's in year 1, and then in year 2, you could access further funding to do bespoke training. If you're a local authority, HCP or primary care applicant, you have to pick one or the other. So it's either we will pay for the masters, or you can have £5,000 worth of funding for a more tailored training plan. Regardless of your backgrounds, you can have £1,000. Sorry, Chris, £1,000 conference fees, £1,000 towards working with people and communities, which used to be referred to as PPI, and research inclusion, and £1,000 for your supervisor. And if you already have a relevant master's, you are able to use this award to bridge, as it were, to your next career step, with the expectation that you would apply for a shorter version of it, for example, 6 months. Next slide, Chris. Thank you. So this is our definition of methodologists that can be supported through this award. So you may be, for example, a trial or study manager, statistician, epidemiologist, etc. It is not an opportunity for you to just apply to learn a technique to answer a larger, more substantive question in a specific area of research. And if you are going to aspire to be a methodologist through this award, you should have a relevant undergraduate degree or master's level qualification in a relevant area. And ultimately, you would be looking to go into one of the areas listed there in the bullet points. So, for example, medical statistics or clinical trial design, etc. Next slide, please, Chris. So now onto the PhD funding opportunity that we offer. So our simplified doctoral award will launch later this year. We're currently in the tail end of the pre-simplified doctoral schemes, going through their funding recommendation meetings, etc. So the doctoral award, as it will launch in October, will give you salary time to undertake a funded PhD by research in health and care. And it's open to all aspiring research leaders, but your remit, your proposal, I should say, must fall within our remit for personal awards, which Chris showed earlier on. If you're a clinician or a practitioner or based in a local authority setting, you can optionally include 20% funded clinical or practice time within the award. So applicants for the award should hold a first class or upper second class degree or a master's degree. And if you've already registered for a PhD or an MPhil with the expectation that it would transfer to a PhD, you can only apply if you've been registered for less than 12 months at the time the award starts. So funding and support, we will pay 3 years whole-time equivalent, although you can have the award on a part-time basis between 0.5 and 1.0 WTE. The award will fund your salary, research costs, working with people and communities, which was previously referred to as PPIE, and training and development costs. And you can have up to £3,000 for conference attendance, travel and subsistence, and the award will cover your full PhD fees. When you apply for an NIHR award, you will be able to see in the funding opportunity which of our charity partners are participating in a particular call. And if that is of interest to you, there's an option to indicate that in your application. Although I should also point out that if the charity partnership is not able to co-fund your award, the NIHR will fund it in its totality. So at the doctoral level, this funding call opens twice a year in April and October. I don't think I mentioned, but for the predoctoral award, that only opens once a year, and that opens in January. As Chris has mentioned, everyone is going to be using the same application form as we have simplified our doctoral level offers. And once you've submitted an application, members of Academy staff will send your application to the most appropriate of our committees, depending on your research setting and area of interest. So there are 3 committees at doctoral level, one for local authorities, social care and public health, one for the health and care professionals, and then there is a committee for all other applicants. Next slide, please, Chris. So beyond PhD. So once you have a PhD under your belt, you can look at our postdoctoral award offer. So it's both for early career postdocs and also for later career postdocs. So it's an opportunity to establish yourself as an independent researcher, or if you're already established as an independent researcher, to develop and be recognised as a leader in the field. You can also use it to re-establish a research career following a career break or a period dedicated to professional practice. So as with the PhD award, we will fund your salary, research activities. In this case, we'll also support research assistants. There's a conference attendance budget and also money for training and development. So with the postdoctoral award, you can choose your award duration. So you could have an award of between 2 and 5 years duration, and you can have 2 sequential awards, but the total duration of both of your postdoctoral awards is limited to 8 years whole time equivalent. So you may, for example, want to do a 3-year award followed by a 5-year award, with your second award being a more substantive piece of research. If you are a clinician or practitioner, you can cost up to 40% of your award time to the development of your practice or policy role, which will be funded by us. As with doctoral applications, we open twice a year. Postdoctoral award opens in spring and autumn. And as with the other simplified awards, everyone uses the same application form. And then once we get the applications in, we will direct your application to the most appropriate of our 3 committees. Next slide, please. So we'll just briefly go over this. So as we showed in the data in the introduction, so we do also fund all the way up to professorial chair. So this is our most senior fellowship offered. It's open to any professional background, so clinicians and non-clinicians. It's open to applicants in universities, NHS trusts, and other providers of health, public health and/or care services based in England. Research applications are by nomination only, and there's a maximum of 3 per university or organisation for each round. It's 5 years funding, funding salary, 3 support posts, research and leadership training costs, and annual launch once a year in September, And if you're interested in that, you should go and have a look at the supporting information on the website for further details. Next slide, Chris. So we're on to additional support for your career development, and I think I'm handing back over to you now. Okay, thank you.
Thanks, Kieran. Yeah, so I think what Kieran's been running through there are sort of our more sort of classics of fellowship opportunities, which would have at doctoral and postdoctoral level a research proposals embedded within. Now I'm sort of going to run through our shorter term awards that have slightly more specific focuses and often targeted more towards training and development rather than undertaking a research proposal within the personal award itself. So here we have the pre-application support fund. This is a award we've been running for just over a year now, a year and a half now. And this is a sort of more targeted award that we've set up that provides small pots of money to enable you to prepare a competitive application for one of our career development awards. So often that would be our predoctoral, doctoral or postdoctoral or research professorship level award. It's available at all career stages. But one of the key things here is rather than part of our standard career pathway, we ask for applicants or expect applicants to have this clear case for support. So the aim of the award is to try and support individuals that require additional support in order to prepare an application. So applicants generally need to be able to demonstrate why they need support, how they would use the pre-application support fund to overcome that barrier that you may have from applying, and be able to give the committee confidence that with that support you will be able to submit a competitive application. We do with this programme, as with other schemes, we do particularly encourage applications from certain professions and groups, and methodologists are included within that. So you don't have to be a healthcare professional to apply for this programme. You can be a researcher based within a university, for example, but you just need to have a personal case for support. Funding is available for up to 12 months, and this is a highly flexible funding opportunity where we will support a contribution to your salary costs, funding for training and development, mentorship or supervision, and some PPI costs to support preparing your application can also be included within that. And then we also have this very broad other cost category. I think for time I just recommend going to the guidance notes for those, because that's only there's sort of in place for specific circumstances where an applicant may require additional further support to prepare an application, and we do give some good examples in our guidance notes for these. And as with our other short-term training awards, this opens 3 times a year with the intention to provide plenty of opportunities for you to apply and to also enable you to align your application to this scheme with your intended future grant application, where, for example, if you were to apply for a postdoctoral award in the future with support from the pre-application support fund. I'll now take us on to the Development and Skills Enhancement Award. So while the pre-application support fund is available to all career stages, this is a postdoctoral award that is available to anyone within NIHR's remit. So you don't have to be an Academy member or previously been funded by us to apply for this. And this is a shorter term training and development award as well that can be held for up to 2 years. And it's aimed at supporting sort of early to mid-career researchers in gaining that specific skills and experience you need to make that next step in your research career. So this has a broader remit, but it's really key that applicants are able to demonstrate why you require this additional support again, and how the additional skills and experience you'd gain during this award will take you to the next step of your research career. Funding is available for 12, 18 or 24 months, and this award can be held between 50 and 100% WTE. And similar to the previous award, it can fund salary time, training and development costs, and conferences and mentorship costs. And is also open 3 rounds per year. And so I think because it has a focus towards skills development, it's particularly well aligned to individuals from methodology or health data science background. And indeed, it does have strategic themes, or again, these areas that are particularly encouraging applicants from, of which health data scientists are one of those. And you can see here further down the slide that we give some examples of the skills in data science that could be developed during this award, including machine learning, statistics, computing, sort of wider domain knowledge, or wider health research skills. They can be broader. They don't have to be specifically related to, or training course related to developing your data science skill set, for example. And on top of our personal awards, we do also have a wider capacity building initiatives across NIHR. Again, for time, I'm really going to skim over these, but we've been talking about national funding opportunities, but across NIHR, we also fund a wide range of infrastructure centres. And there are a number of these that are listed on the slide that within their wider remit also have a remit for capacity building. So they do offer career development funding opportunities locally within their region. So these are the BRCs, the Biomedical Research Centres, PSRCs, Patient Safety Research Collaborations, the Applied Research Collaborations, the Health Protection Research Units, and then the nationally focused schools for primary care, public health, social care, and increasingly career development funding is also available through our programme grants. So I think that's more steer to say that while look towards us as well for national funding, but often do also think about the infrastructure centres that are available to you locally. And each one of these centres will have an academic career development lead, and you can find the contact details of that lead often on their specific web pages, but also on our web page as well. And they can be a really useful source of information for any training courses or career development funding or personal funding that may be available or coming up in the future. We also offer funding, or we've also set up what we call NIHR incubators. So these are sort of nationally focused centres that operate at a national level and have a focus on building capacity in specific areas of need. So they last for 5 years, and they each have a specific area within health or care research they are looking to build capacity within. There are a number of ways in which they do this on this slide, but what I'll do now to focus in on is I'll just show the wide range of incubators that are currently operational. So they're the 10 on the top half of the screen, with 5 more becoming operational this year. And I thought there were 2 that are particularly relevant to the audience today that I just wanted to highlight. So the first are the Applied Health and Care Research Methodology Incubator. So this incubator is well established now and has been operating for a number of years, and has a real aim in raising awareness of methodology careers in health and care. I'll include a link on this slide, but they also have a good website where you can join the methodology incubator, and it can be a really good resource for finding out more about funding opportunities or training and development opportunities that they may be running, or webinars, for example. They also have quite a nice research network map that you can sign yourself up to, and is a good way of finding other methodologists within a wide range of disciplines across the country. And they also have a health data science sort of sub-discipline area as well within the wider methodology remit. And then more recently, we set up the Regulatory Science and AI and Digital Healthcare Incubator, which is helping to build a research community that can collectively advance regulatory science and responsible innovation for AI in healthcare. So again, I've got included a link here to subscribe to this community, and on their webpage, they have been running a number of webinars focused on specific topics. So I think they're often useful communities to subscribe to because webinars and training opportunities will often come up that may be relevant to you, and they can be a great way to network and identify new resources within your area. And finally, just talking about the Team Science Award, because again, we thought this was particularly relevant. So this is a relatively new award that we've been running that tries to bring together teams from diverse disciplines and backgrounds to address complex health and care challenges. So it's really an approach that tries to foster a collaborative research culture with individuals from different disciplines, backgrounds, career stages, research fields, and obviously those with expertise in data science analysis and methodologists are always a critical part of these research teams. We operate around each year, and each year that will have a slightly different focus. So in 2023, this was on multiple long-term conditions. Last year, we had an applied health and social care research methodology focus. The next round is yet to be determined, but I would just recommend keeping an eye on our webpage for updates about this. And this funding comes in two parts. We have a team science camp that operates in the autumn each year, that with an expression of interest form going out earlier in the year. Which is a 3-day residential team science camp that provides coaching and further information on establishing and delivering multidisciplinary research teams. And you don't have to apply to the award and attending that, but it can be a great opportunity to apply and gain further skills in this area ahead of thinking about applying for a team science award that provides up to £100,000 worth of funding over 6 to 24 months to form a team. And that team can be established to deliver a pilot research project, for example, that may underpin a future grant application, to access data, or to build wider collaborations or necessary training required for a future research project or grant application. And then we did just very quickly touch on this, but a number of our schemes, particularly our personal awards, offer charity partnerships. So it's always worth, if you're interested in any of these, looking towards the particular funding opportunity. We've just listed some of the past ones we've had here, and it can really be representative of the best of both worlds, really, an opportunity to gain support from the NIHR, but also alongside that, a charity partner with specialist expertise in your area. And then we also have a number of partnership awards that we've just listed here because it's probably too many to mention, but it's always something else to keep an eye out on wider funding opportunities that we offer with other funders. And then just at the end for use, we've just included lots of links that will hopefully be good source of information. I think on here, I just recommend signing up to our newsletter. That's a really good source for just keeping up to date with upcoming developments from the Academy and new launches. And then we've included a few QR codes to useful links on our webpage. So I think that's everything from us.
Thanks, Chris. Do you want to unshare the presentation? Thanks, Chris and Kieran. That was a wonderful presentation and kind of tour de force in terms of the opportunities that are out there. I sort of forgot to introduce myself at the start. So I'm actually NIHR chair of the postdoctoral committee, the Advanced Fellowship Committee, and also the MRC Clinical Training Fellowship Committee. And my program focuses on data science, both using national data and the regional data within the Southwest. So working with Chrissy and others. So really a great team. So thank you very much. And questions?